Assalamu alaikum. Hope you all would be doing fine. I was sitting in the hospital when a patient entered in the room and handed over a slip to me. His blood pressure was checked at the reception, and the blood pressure was written on the slip. It was it was between 165 to 170, and the patient was very anxious that his blood pressure is raised. And we rechecked his blood pressure with proper technique, and after rechecking it was 140 to 145. So if the proper technique of checking blood pressure is followed, then there could be so much difference between the actual blood pressure and the blood pressure recorded. So today's video is about how to check blood pressure in accurate way. So there is a standard way to check blood pressure. It's not just random checking. There is a proper technique we should follow if we are checking blood pressure of the patient, if we want to assess the real blood pressure of the patient. So in this video we will discuss about the proper technique of the blood pressure. So there is a 30 minutes preparation rule. If you are planning to check the blood pressure of the patient, make sure that the 30 minutes preparation rule is followed. Avoid any activity. There is a rule of thumb. Avoid any activity that either increase or decrease your blood pressure 30 minutes before checking. For example, there should be no intake of coffee, tea or alcohol, as they contain caffeine, which can increase the sympathetic activity and blood pressure. So it could be falsely elevated if the patient has consumed any of them 30 minutes before checking blood pressure. The patient has not done exercise before 30 minutes. There should be no cigarette smoking, and the bladder should be emptied. If the bladder is full, it can falsely elevate the blood pressure by 10 to 15 millimeter Hg. So the bladder should be empty. No cigarette, no exercise, no coffee, tea or alcohol intake at least 30 minutes before checking blood pressure. This is 30 minutes preparation rule. After following this rule, then we come to the next step of checking blood pressure. So patient should sit on the chair with back supported and feet on the ground flat. Sorry, this was mistakenly written on this page. It is not floor, it is flat. So patient should sit on the chair with back supported and feet flat on the ground, as you can see in this picture. As you can see in this picture, patient is sitting on a chair with feet flat on the ground and the back supported. Patient should not sit on the couch or bed because there is no supportage of back in that case, and the patient legs should be like this. There should be no crossing of the legs. Patient should lie in this position. Patient should remain in this position for at least 5 minutes. His arm should be rested at the heart level, and when you check the blood pressure, it should be checked bare armed. If possible, his arm should be bare, and then proper cuff size should be applied. If it's either too small or too large, it can falsely show elevated or lower blood pressure than actual blood pressure. So patient should sit on the chair with back supported and feet flat on the ground. Arms should be supported at heart level and keep sitting for 5 minutes. Patient should rest at least for 5 minutes. Then it should be bare arm, cuff size should be appropriate, and patient should stay silent while you are checking blood pressure. He should not speak while you are checking blood pressure. It can alter with the reading. Then discard first reading. Take readings in both arms and average them. If Why we should discard first reading? Because when patient comes to the clinic, he is anxious and the first reading could be falsely elevated. So always discard the first reading. Take readings in both arms and average them. Take readings in both arms uh, and average them. This is correct. But if there is difference between the two arms, then the arm with the higher blood pressure should be considered for further and next readings. So this is how we measure blood pressure with accurate technique. If the blood pressure is still high, then we should move toward the diagnosis of hypertension but there is a proper way. The point I wanted to tell you is that if the blood pressure is checked with appropriate technique, it can make a significant difference.